Lovely to see people coming in. I love this bit actually. It's great.
Yeah,
Thank
me
you.
too. Me too.
It's funny, isn't it? Strange. Thank you everyone for joining us. Hopefully, if you're not able to make it, then you are watching this at a time of convenience for you. But welcome to our compliance clinic, where myself and Pat obviously always find lots of things to talk about, because compliance is never done. So we've got the great Pat Langley with us again. Really, really appreciate these monthly meetings, Pat. I think they're so valuable for people, um, and keeping the topics quite current. It's generally things that have come on your radar, come on my radar
Yeah.
over the last few weeks. I know you've got a couple of things on your list as well, which are really, really helpful to go through. A couple of things that I wanted to just bring up of practices that have been getting ready for an inspection, that has actually uncovered quite a few issues that should have really been boxed off and sorted as a matter of process, not as a panic when the inspectors are calling. Um, I do worry sometimes when I get called in to do mock inspections because I've had four where I've been booked in to go, and then all of a sudden they've actually had a call. I do feel like I am some sort of
Yeah. Bit of a jinx, are you?
bit of it. I think, yeah, I think I am. But it's all good. The way I look at it is it's an
Definitely. Yeah.
opportunity to make
It's
sure
such a
everything's going.
valuable service, Lisa. Honestly, it really is.
I would recommend people, working with like dentistry compliance and, or just completely reviewing, getting an external,
Yeah.
third
Yeah.
eye, um looking in onto these systems, because it is you uncover so much, and we're
Yeah.
gain so much insight on how to make the business better and safer and better well led and everything like that. So a couple of the things that really stood out for me were practices who were very good at getting risk assessments, so fire, legionella, etc., even disability audits, and then filing them away and not actually actioning any of the points. Now, most of these companies, and there are good ones out there, and there are shocking ones. I've seen wrong information, wrong dates, all sorts being put on some. Always make
You're
sure
asking for trouble. Just asking for trouble.
massive. And they generally do kind of a high, medium, and low risk, don't
Mm.
they? Now, you know, my view is a risk is a risk. Yeah, we need to look at the red ones first, but the risk is there.
Mm.
And I think this comes from people not understanding it, not even taking the time to read it, actually, not even realize actually I need to do something. Um,
Yeah.
is that something that you've come across?
Absolutely, all the time, Lisa. So, and it's a waste of time, money, and paper if you do it on paper. Just literally doing the risk assessment, but not following it up on it. So, yeah, absolutely. Otherwise, it's pointless. What on earth is the point in doing a risk assessment if you don't do anything about what you find? And it's not about, the other thing we find is it's not about practices just saying, yeah, no, we do all of this already. And as if it's some kind of test you're passing. The whole idea of a risk assessment is that you are looking for things that could cause a problem.
Mm.
And you're looking at what measures you've put in place to mitigate that problem. So my favorite definition of risk is the problem you don't know you've got yet. And
Mm.
so the idea of a risk assessment is to identify things that could be a problem so that you don't then think, when something goes wrong, you don't then think, oh dear, I wish I'd thought of that. So the whole idea is to identify what could go wrong, identify what you're currently doing to mitigate that risk, and then thinking about, is there anything else we need to do? And then any actions arising from that. So the thinking about, is there anything else we need to do, then should be delegated to a person, and with a completion date attached to it. So yeah, otherwise it's pointless.
Absolutely. And you're not just looking at one or two problems here, are you? You've got your legal, you've got your insurance risk, you've got your
Yeah.
safety, and then you've also got the CQC GDC
Yeah, you
risk.
have, you absolutely have. And I just think that it's not even about the CQC or the GDC in terms of we're doing it because of them. We're actually doing it because it's the right thing to do. So think about a fire risk assessment, for example. The idea of that is that it prevents you or reduces the risk of you having a fire in the practice, which is devastating. So it's not just boxes to tick. It is looking at what have we done already and do we need to do anything else so that we don't have a fire in the practice.
No, I agree. It's making sure that you're not just doing the minimum standards and
Yeah, absolutely.
requirements.
Yeah,
It's
yeah.
like 5 people. I don't know if it's changed now, but it used to be five. If you've got less than 5 people, there was a slightly different
But that's a
regulation.
health and safety risk assessment. Yeah,
Yeah. And
yeah,
it's like,
yeah,
well,
yeah.
does it not matter about five?
What about the 4 people? What if you've only got 4 people? So I think it's all about a written thing at 5 employees. But yeah, I think yeah. What about if you've got a practice that's only got 4 people in it? What do you do then? Yeah. So and also the same for audits, Lisa, as well. So patient record audits, infection control audits. You're looking for what is not quite working so that you can put it right, not just so you can tick a box. And I've run training days where it's come out that people thought that all they had to do was tick a box, and they didn't realize they had to do anything about it.
No, it is. It does, and particularly when I know, obviously, when you're speaking to team members, and I'm talking to team members, um, particularly with the looking at how well led the practice is, which is critical for the for everything to tick along and work well. Making sure that we are asking our teams what they think, how they
Yeah,
feel, um, and actually being brave enough to do it and take it on board because it will come out most of the time. I do. I know I bang on about this, but when we aren't doing things quite right, things could be better and we're not actioning them. You've most practices have got some members of the team that will bring that up and bring it out into the open. And if we don't action it, it's awful again. It's like an unactioned risk assessment.
mm,
It's like look at what the problems are, look at how people feel. Not just because we want to, be well led, but because we want to have a great practice with good systems and happy
yeah,
people, you know.
yeah, absolutely, absolutely. I completely agree with that, Lisa.
I think that the areas for me that I'm seeing where people are really dropping the baton a little bit is the IPC audits, radiography audits, record keeping audits, Legionella.
Yeah,
And I know, in fire risk assessments, and particularly those two, I feel like it's often felt there's a very, if we have to action these things, there's a cost implication. And yeah, there can be, but you've got to at least start actioning what's on those risk assessments, haven't you? And also
yeah,
competency sign-offs, sometimes
yeah,
overlooked, making
yeah.
sure that people are actually competent in what they're doing.
Definitely, yeah, yeah, absolutely. Again, on this one particular training day, I did quite a little, not that long ago, a couple of years ago, probably. Um, the IPC audit had been delegated to somebody who it shouldn't have been delegated to, and all this person had done was just go around and tick everything. And so I said, "Well, is that actually what is happening in the practice?" She said, "Oh, I don't know. I don't know how to tell. I thought I just had to tick the boxes." So I think, yeah, I agree. It's somebody needs to be, well, obviously somebody needs to understand, the person doing an infection control audit needs to understand infection control.
Yeah. And there are so many extra courses out there that people can do. There's so
Yeah,
many
yeah,
resources as well, aren't there? As well as,
yeah,
paying for support systems. Um, one of the other things I know you've been dealing with quite a lot lately is, not personally, sexual misconduct.
Not no no
Sorry, I know it's not a
not
funny subject, but
personally. No. Yeah, yeah, absolutely. So I've recently updated at Dentistry Compliance. I've recently updated our sexual misconduct policy. It was actually called sexual harassment policy before, but there's some new guidance come out that it's more than just harassment. It's sexual safety, sexual misconduct, sexual harassment, that it needs to be a much broader, more encompassing policy now. And there is also the Sexual Safety Charter that all practices, certainly all NHS practices, and why wouldn't you do it if you were a private practice as well? All NHS practices are required to sign up to the Sexual Safety Charter by the 31st of March this year.
we need to get that done before next. People need to get. We did ours a few weeks ago, and it was very
Yeah,
easy to do. It wasn't
yeah,
difficult.
absolutely. Yeah, absolutely. So I've also updated our sexual safety risk assessment as well. So I think for those people on our call today who are not using Dentistry Compliance, just make sure that whoever you are using has updated the policies and the risk assessments in line with recent requirements. And if you're in any doubt, then feed it into Chat GPT and see what Chat GPT has to say about it. But yeah, so I think it's really important. I've also written an article for Dentistry magazine as well on it, which in actual fact I thought when I was writing it, I thought, goodness me, this is a bit over the top, really. But actually, as I said, I've since heard that this is something that's happening more and more in practices. I also think it's a little bit of a generational thing, in that, behavior that probably was never really acceptable, but it was kind of overlooked in the past, is no longer acceptable at all. And what anybody still behaving in what I call dinosaur style needs to be aware of is that younger team members are very aware of these kind of things now, and very aware of what you can say and what you can't say. So this isn't about being woke and saying, oh, well, the world's gone crazy. This is about making sure that you don't say and do things that make people feel uncomfortable.
Yeah.
So yeah, I think it's quite a big thing, and I think that there will be more and more emphasis placed on this as people really kick back and say, no, this isn't acceptable. You can't say things like that in a work environment.
So part of this process, Pat, is I mean, everyone should be doing staff questionnaires anyway, and they should be anonymous. It should
Yeah,
give people
yeah,
that anonymity to be honest without any repercussions. Um, but
yeah,
there is also, it is asking quite specific questions about
yeah,
sexual misconduct.
yeah,
I think you're right. I think there's a lot of things that will be coming out.
yeah. I do.
Innocent
I,
things
I do.
most of the
I do
time.
too. And if you think about the impact that the Epstein files has had on the world, really, and some major, um, major personalities, whether in business or politics or whatever. I think that in itself has raised people's awareness of, well, actually, it is okay now to raise these issues, and I will be listened to. Whereas, if you go back maybe 10 years, then I think there was a fear of, oh, well, it's always been like this, and, nothing I say is going to change it. That's not true. it was probably or shouldn't have been ever true, but it most certainly isn't true now.
It's it is going to be. I do think it's going to be an eye opener, as I've mentioned.
Yeah,
And within dental practices, it's an environment where we've got lots of different people on different levels of
yeah,
responsibility,
yeah,
and
absolutely.
ages as well.
Definitely, and that's why I call it dinosaur behavior, actually, because people continuing to behave in outdated ways and say things that they got away with 10, 15, 20 years ago, and they just won't now. So I think it is very important, and also it's a legal requirement not to. So if somebody raises a concern, then it's a legal requirement not to have that in good faith. Um, it's a legal requirement not to for that person not to suffer any detriment. So not to be talked about as, oh well, he or she would say that, wouldn't they? And well, their time here is going to be limited. Um, that sort of thing is illegal. Not just not a good idea, it's illegal.
Yeah, and we've got the whole we've got to get a head around quite a lot of this and how to manage things, I think, because obviously if we're getting anonymous concerns being raised, we then need to obviously address it with
Yeah,
maybe as a group, or if it's a bit more serious, individuals.
yeah,
And then this is where you hope that you've got a fantastic HR support
yeah,
um,
yeah, definitely.
service that you can go to get some really good advice on how to manage the situation. Because it can, you know, there'll be, some people that are doing it honestly, and there'll be maybe some people with a reason why they want to
Yeah,
say
yeah,
something.
for sure.
It's going to get very complicated, but part of it is doing some training as a whole team of what's appropriate and what's
Yeah,
not.
definitely, definitely. And I think it's also about people understanding professional boundaries and staying within them. And I think the times of raucous staff parties, really, I think that's a very risky thing to be uh,
Yeah.
indulging in now when you involve alcohol. So I think that, part of your risk assessment should be, so how do we alert everybody in the team without sounding um, bossy or prudish or whatever to, this is the behavior we expect both in the practice and when we're out together as a team as well.
Yeah. I mean, we've always had a Christmas party policy.
Yeah,
Um, we work with Sarah Buxton, so she
yeah,
would not allow us not to have these things
yeah,
in place, which is great. When we're a big team of 40 odd people,
yeah.
it's a lot of people to keep my eye on.
It certainly is.
It's like
Even for you, Lisa, that's a lot. That's a lot of people.
herding cats. Um,
Yeah,
and I do know of things that have happened at Christmas parties. I've recently heard about someone that had been actually sacked because they were having it was all very innocent, genuinely innocent. Um, but when you look and you go, okay, they'd had a drink, um, they'd done something that was pretty innocent and was quite normal. And somebody else in the practice had decided that, the rule of you don't have to be the victim to be the victim. Somebody else
mm,
brought it up as inappropriate behavior,
yeah,
even though it wasn't to them.
yeah,
And they ended up being dismissed. It's kind of just getting the rules in place of what's expected and what's okay and what isn't just can save
yeah,
even injustices being
yeah,
done as well as
yeah.
justified reasons.
Absolutely. Yeah, absolutely. I think it's very important.
Massively. It does get to the point where I know practices that like really shy away from doing social events. No.
I'm not surprised. I know of some law practices as well, that do that. That these are sort of groups of a group of lawyers who are in their 40s, and they've stopped having office parties because the risks are just enormous. And they work in the legal world, you see. So I think, yeah, I think, but I think it would be a shame if it stopped you having social outings, because I think it's really important for team building to do that. You just need some ground rules.
Yeah, oh, 100%. Yeah, we've got a team day coming up in April, and we've got a serious morning. We're doing quality and diversity and
Yeah,
team culture and all
yes, sure.
and then in the afternoon we do some fun team building.
Yeah, yeah,
But I always make it a surprise for people. But yeah, it does make me go, there needs to be rules here.
yeah,
Because we do hold it in the sort of local pub in a really nice function.
yeah, sure.
And it's like
Yeah,
I want people to enjoy themselves, but not too much.
yeah, absolutely. Yeah,
Not too much. But it will be interesting to see what happens though, because if we do get an anonymous concern, I suppose it's not that different from whistleblowing, but if something is said against somebody and we need to address it, it's
yeah,
really
absolutely. And
difficult.
also, of course, the other thing in a practice is you mentioned the age difference, and I think there is, because there's a hierarchy in the practice, and that you have senior people and you have much more junior people, and it's very important that there is no abuse of power. I think going on as well.
Mm.
Um, and sort of there's a huge gap between the very young trainee dental nurse and the much older clinicians in the practice, and I think that's a challenge as well.
It is, given, it's a very close proximity
Mm,
relationship as well,
mm,
isn't it?
mm,
There's not
absolutely.
that many
And
jobs
then,
where it's that
yeah,
close.
yeah, and then of course you've got to factor in, I think, the patients who might be on some kind of vexatious vendetta, in when I've experienced that. Uh, a dentist who started a relationship with a patient very ill-advisedly, then decided not to continue it, only to discover the patient was an investigative journalist, and so that went very, very badly wrong
Wow.
indeed. So I think, but this is why I said it's so important maintaining professional boundaries, and what you can do and what you can't do.
Yeah, and it kind of leads onto kind of the sexual charter. And again, like you said before, you know, yes, we need to do these things, especially if you are an NHS practice, but it's the same with complaint
Yeah,
handling and other systems that we do
yeah,
as part of the NHS contract that we should, was not brought, for example. So there's things that we should be doing even if we're not NHS because it's the right thing to
definitely. Yeah,
do.
definitely.
And the sexual charter, I think, is going to throw up some serious questions because we know that it's kind of more aimed at hospital type scenarios. We have
Yeah.
chaperones naturally anyway, but then we've got this, the new contracts coming in, the dental nurse practitioner, oral health practitioner course, where dental nurses are able to go into patients' mouths, have varnish. Do they need a dental nurse nursing with them?
Well, depends, you see. Now that's another very difficult area, and it doesn't just apply to them. It also applies to hygienists, because a great many hygienists don't work with a nurse. And even though the GDC in standards for the dental team specifically says you must be accompanied, and a GDC registrant clinician must be accompanied by a suitably trained person. Now, and then it does go on to say that the exception is an exceptional circumstance. Well, you can't have an exceptional circumstance every day of the week. So and I think that there's a huge number of hygienists that work without a nurse and don't want a nurse, and are happy working the way they are. But I think it's it isn't what the GDC says, and also it's very clear that you should have a chaperone, and so I think it's a lot of unanswered questions. Well, are they unanswered? I think it's pretty clear. What you choose to do about it, of course, is up to you.
Yeah, I mean, there's so many things that you can argue about. I mean, I would argue that a nurse that's generating UDAs, should they have an NHS pension? That's a whole different that's
Yeah,
a whole different topic. But
whole
it's
different day and
it's
conversation.
it's
Yeah,
kind of
exactly.
introducing these things, but
Yeah,
there needs to be more of a discussion surrounding it rather than, oh, you can do this now.
yeah, exactly. Yeah,
It's crazy.
yeah.
So I'm just having to think, the sexual charter, getting that done by
31st of March. Yeah.
31st of March. Um,
Checking your policy, and if you're concerned that your policy might not be up to date, and if you use Dentistry Compliance, we haven't posted the updated policy yet, so that'll be in the next 24 hours or so, and the risk assessment as well. In fact, I think Sam Spriggs said that it's going on today, so hopefully that'll be on today. But also checking, if you don't use Dentistry Compliance, then checking that your policy is in fact up to date, and just feed it into ChatGPT and you'll find out.
yeah, brilliant. So yeah, obviously the sexual chart is something that needs to be on our radar. Is there anything else that has been
Yes.
cropping up?
Yes. So a couple of things. In fact, one I didn't mention to you earlier, which is meningitis. So we sent out to all our members, just it was intended to be reassuring, that just saying, that we're monitoring it, which we were, stroke, sort of still are, but it has now peaked, and doesn't seem to have spread outside Kent as such. So we sent out a message to all our members saying that advice from the UK Health Security Agency is that it's in business as usual in terms of infection prevention and control. But I think I know our members that use Dentistry Compliance like belt and braces. So I did also say on that, if you do feel you want to use some additional measures, because because the early symptoms of meningitis are like a cough or a cold. And so, if you do feel that you want to perhaps upgrade back up to an FFP2 or 3 mask, then you should feel that you could do that, I think. Jason Wong, the Chief Dental Officer for England, has also put out a message, which he and I had some discussion about before he put it out. And his message is perhaps even more reassuring than ours, which is just to say it's just business as usual, basically, and they'll keep an eye on it. So, yeah. So, but I do think that the concern is reducing, unless, of course, you live in Kent, which obviously there are a lot of dental practices in Kent. So perhaps if you do live in Kent, then you might want to just be thinking about screening your patients before they come in. Again, that's probably the most useful thing you can do, rather than gearing up with enhanced PPE.
Is there anybody here that is in Kent that's happy to reveal themselves? Has you noticed any difference? Oh, Ellie, I didn't want to volunteer you. But I was
Sorry.
like, yes, I know. Thank you for coming forward. Really appreciate it. What's happening, Ellie?
Yeah, so it's pretty much business as usual. I know people at university who have been with people who are affected. It's just the unis that are being careful. Pretty much in my local town, all the uni spots, clubs are all closed at the moment. I think next week, they're all reopening because it's all stabilised. So we're just being cautious, really.
Yeah, absolutely. And I think COVID has taught us you can't be too careful. I think a lot of people felt, including the government that they didn't really plan as well as they could have done. So I think, and this time they've been amazing. Actually, the UK HSA has been amazing and started the vaccination program. So I think, yeah, just keeping an eye on things is a good thing to do.
No, that's good. Thanks, Ellie. I know
Thank
it's
you.
like my daughter's one's in Manchester, one's in Liverpool, and they they were like messaging me going, do I need to do anything? And I'm like, of course, they're adults now.
Yeah,
I'm like, do you know what? Just message the doctors or ring the doctors
yeah,
and check.
yeah,
'Cause bad mother,
yeah,
but I don't remember. I have no idea. I did every vaccination that was offered and available for them.
yeah.
I don't remember, they're like,
No, I probably unlikely, Lisa, that so this is a particular strain of something of meningococcal meningitis, a particular bacterial strain called Men-B, and I think it'd be very unlikely that anyone's children were, certainly university age children were
yeah,
immunized against that particular strain.
yeah. They're back from uni for Easter now,
Yeah,
these
yeah,
big holidays. So my piece has disappeared. So they're kind of they're okay. At least they're
yeah,
not mingling with
yeah,
everybody
yeah.
now. So yeah, no, thank you for that. And thanks, Ellie. That was really helpful. One of the things that drives me a bit insane, um, conversations constantly based around radiography audits. I'm sorry, everyone. People finding it, who is the appropriate person? Who should be doing these? Who can do these?
How do you mean? What do you mean by radiography audit,
Having a
Lisa?
look if are clinicians marking down it
Oh,
correctly
right.
in
Okay.
notes?
Okay. Well, the problem is it has to, I mean, obviously the clinician must assess their radiographs and uh, and mark them as acceptable or unacceptable or not acceptable. So that the grading 1, 2, 3 has gone now. So it's either acceptable, A, or N, not acceptable. So there's only two choices. Now it's the clinician's role to do that. Now, because it's only a dentist or a clinician that is able to read the x-ray. That's not to say dental nurses can't read the x-ray. They can see what's in front of them. But it is the GDC registrant, and when I say GDC registrant, I'm talking about hygienists who have the training to do it as well, or therapists. It is the GDC registrant's responsibility. It can be somebody else's responsibility to check that they are doing it. But again, they should know, the person that is doing the audit should know what they're looking for in terms of acceptable or not acceptable. Now, I think that if you see on a radiographic quality audit that every single x-ray is marked as acceptable, I think we all probably know that that's unlikely to be realistic. So whilst it's not the responsibility of a non-clinician to decide whether the x-ray is acceptable or not, that if you see that everything is acceptable, then you should ask questions about it and look at it a little bit more closely. But that the person doing that should be trained in what they're looking for. When I say trained, I mean they should know that it's not 1, 2, 3 grading anymore. They should know that that it shouldn't all be acceptable, because that's highly unlikely. And they should know that they can raise it with the clinician and say, this is really interesting. It's difficult to do, mind you. This is really interesting. Can you just, can we look at some of your x-rays together, perhaps? Now that needs not to be a trainee dental nurse, that's for sure. So I think somebody who is, more experienced and trained in what they're looking for.
I like the word, this is interesting. Can you have a look? I think that's a great.
Can we have a look at this together? This is interesting. Golly, look at this. Aren't you great?
Or
What a
not.
marvelous record. Can you show me? Can we just have a little look at these together? The problem is, and I hope there aren't any dentists on here today, the problem is that we as a profession are not very good at going, oh, we haven't quite done that as we should do, unless it's in front of us.
Yeah.
So if say, Lisa, you're going to be looking at the radiographic audits and you see everything is yes, wonderful, all the x-rays are wonderful, then for you to say, can we just have a little look together, is very different from you saying to one of your dentists, well, it shouldn't be like this, should it? Because it's not possible that you're completely perfect all the time, is it? Because they're going to say, well, actually, I am perfect all the time. So it's much better that you let the clinicians self-discover. It's incredibly powerful.
It is. I agree. I like, because telling somebody something is not always.
Because they're going to say, oh, but I didn't.
Mm.
So there's nearly always going to be some kind of denial going on.
We have one of our radiography trained nurses, and Decky has raised a question along those lines. Would a dental nurse qualified in dental radiography be acceptable for that assessment?
For what, Decky? Do you mean checking that the audit's been done or doing it? And if you mean checking the audit's been done, yes, definitely.
Yes. So in our position at the moment, we do our 3 monthly audits on our host location staff, on the clinicians. They would they're getting done by our coordinators. So some of them have clinical backgrounds, but not all of them. So in
terms of deciding whether an X-ray is acceptable or not, it needs to be a clinician doing that. In terms of checking to see that the audit's been done and it looks realistic, then yes, a dental nurse qualified in dental radiography is great to do that.
Okay, so it would need to be a clinician checking them.
Yeah. Well, the clinician needs to rate their own radiographs and say whether they're, unless you've got a system where clinicians rate each other's x-rays, but knowing how difficult it is to get clinicians to do anything like that, I think just expecting a clinician to rate their own x-rays as either A, acceptable, or N, not acceptable is what you should be doing.
I mean, that's what they're doing currently in their clinical notes. We then audit those. We'll take a cross-section of those, say 20 radiographs, and then we will audit them. And then obviously if there's a pattern, the coordinators do that, they then send it to me and I'll have a look, and I'll be looking for patterns to see if anything is that acceptable for the coordinators still to be doing that, even though they've not got, some of them haven't got clinical backgrounds.
I think preferable to have somebody with a clinical background, if at all possible. And so, as I said earlier, certainly not a trainee.
Absolutely. Okay. Thank you, Pat.
You're welcome, Decky.
Thanks, Decky. It was lovely to see you at the show last week, Decky, by the way.
Thank you. And you. I'll see you in Birmingham.
I didn't see you, Decky.
Oh no, I was only there on the Saturday.
Right. I was there on Friday.
I went to the BDI Big Bash, the Bendente Big Bash on the Friday night, and then I did Saturday. So I'm sorry I didn't see you.
I've got to say, Decky was a little bit sore the next day because she danced a lot at that Big Bash.
Did she? Good for you, Decky.
Yeah, my feet were a tad sore, especially by the time I got home at 8 o'clock on Saturday night. But it was all well worth it.
It was definitely worth the pain. Definitely,
absolutely.
We get our clinicians to obviously do their own NOU, yes or no. But then we have a specific dentist, one of the partners, that then will cast over so that they can have
Great. Yeah.
one-to-one with each of the clinicians. They have to take some responsibility. They should be leading the clinical activities,
Yeah.
in my opinion.
Yeah. Agree.
I know not everyone will want to get the principals on board with that.
Yeah, but
They should be.
Yeah, they should. And do also bear in mind that it is for everybody's protection. So it is for the associates' protection and also for the principal's protection, because if something is going unnoticed that then crops up at a later date, then that you might have been able to stop by involving yourself as a principal, then I think it's a good thing to do.
Yeah, no, totally agree. On the subject of audits, I know we bang on about this, the importance and the fact that you guys are all, interacting in this kind of support is fantastic. The number of practices that aren't doing regular audits that should be done, the mandatory audits, and they are going into a panic when they get a notification. The CQC can see if you've done a panic improvement.
Yeah, absolutely. Yeah. Oh, funny enough, all the audits were done the day after the notification. Not suspicious at all there.
No, do you know, every practice, when they get a notification, there's always going to be, oh my goodness, let's get this in place. Oh my goodness, it might be, make sure the nurses get the nails off. There's always an element, not in my practice.
No, of course not. No, I wouldn't expect that at all.
But there's always an element of it's like panic buying, isn't it?
Yeah. Without a doubt, which I think it is understandable. But I've probably done presentations on, what the inspectors are looking for hundreds and hundreds of times. And one of my favorite slides in that presentation is compliance is for life, not just for your inspection. So just just doing what you should be doing when you should be doing it will reduce the panic enormously. It won't cut it out, but it will reduce it enormously.
This is the thing that really sort of drives me wild. It's the stress, as I'm sure you've seen, when someone gets that 2-week notification and you get pulled into those conversations and to help. Can you please come? So
absolutely.
I turn up and we go through what we need to go through, and there's quite often a very large list of things that we need to get in place. At the time, I don't do I told you so. I do there's things we need to talk about after. But at that point, they don't want to hear that. And I look at them giving up the evenings, the weekends, not just the owners, but the team as well. And I kind of think, does not need to be like this.
Doesn't. It really doesn't. If you have a system that prompts you when you need to do the things you need to do, and you do it, then there should not be any panic.
Yeah. And we do say, we're not here to sell things. We do this because actually it's added value and we want to actually be a source of support. But for those that don't have a system, most of the practices I work with have all moved over to Dentistry Compliance. I'm really, really happy that they did. It is the likes of Pat behind Dentistry Compliance, and it's a very different setup than some other companies, which are all, each to their own. Get your demos, choose which one you like. But actually having someone that is giving that extra support in the way that Pat does is really, really fantastic. Which is why if anybody has any questions, please do ask us. You have your own compliance expert sat here who's able to help. If you're feeling a bit shy and you don't want to, you can follow it up with questions afterwards if you want to.
Or pop it in the chat, or of course, always happy to help, always happy to answer questions and do whatever we can, always.
Yeah, no, that's fantastic. Thank you, Pat. So we are coming up to, well, we are just gone past 1:45. If we don't have any questions, we shall release people unless there is anything else that
Anything
people...
at all. Happy to answer questions on anything you like.
Everyone's very shy, aren't they? Hopefully we've covered everything that's...
I hope so. I think we've covered everything that's been taking my time. Oh, one other thing just to say is I've had a number of conversations and been to a number of presentations given by the GDC. And I have been blown away by how much they've changed. And I think when I first heard somebody speak, a senior member of the GDC speak back in November, I think it was, I thought, yeah, right, well, we'll see if they've really changed. I then heard, and in January, I heard a guy called Shamir Mehta, who is the senior lead clinical advisor to the GDC, speak. And I thought, this is revolutionary. This is so different. This is going completely away from this "you're guilty until proven innocent" stance that I think the GDC's had for a very long time. So I've then followed it up with other meetings, meetings with Shamir at the BDIA. I went to a couple of presentations that the GDC gave, and it is true. They have changed beyond all recognition, and they're going back to how they used to be many years ago. And you know, it is not an exaggeration to say that this is revolutionary. What is happening is that there isn't going to be this hounding dentists because they haven't written something in their notes. So I think it's a really, really good thing. And I'm now sure that it's actually happening at Dentistry Compliance and Dentistry. We will be, I'm going to planning on doing some sit around and have a chat with people from the GDC and quiz them, and that will go out as a webinar. So, you know, keep your eyes peeled for that.
No, that'd be really helpful, actually. I am intrigued to see, because I've not personal experience, but knowledge of situations that have been very difficult in the past. And it's good to know that they're actually reviewing how
they really are
handle situations.
Yeah,
so,
absolutely.
No, thank you. Yeah, do keep us up to date with that. So Decky's had CQC registration manager interview last Friday. Oh, well done, Decky. So
well done, Decky. Great news.
I know. I was so nervous. I don't know why, but I literally had the 5, like what we would say, the 5 Chloes, and I covered everything. But he sort of halfway through, he was saying to me, "We don't need to cover that bit because actually you've covered it in your previous question." So I actually give myself a tap on the back because you know, because I'd actually realised that I'd actually knew a lot more than I thought I ever did. And that's just doing things like this and being on, you know, and making sure you're up to date with everything. And I felt more comfortable moving forward if we as a company were to have an inspection on one of our host sites. And also, it's one of the things that I always make sure, you know, I oversee the compliance for the location. So it reiterated to me as well how important it is that they are if they're not up together, then I know that, and we are, that they must comply with this. So I'll be bad cop this afternoon again, because there's some that are a little bit behind on things. Not too much, but yeah, they just have a little, I have to get the stick out occasionally.
Yeah, of course. So congratulations, Decky. I'm not remotely surprised knowing you.
Thank you, Pat.
As I do. And also knowing your organization as I do. You know, I've been effusive in my praise for what you guys are doing and the way you're doing it. You know, you are very, very thorough, and you are just, you're incredible. So I'm not remotely surprised. Well done.
Thank you so much. I really appreciate it. I've just had a bouquet of flowers delivered from Trudy as well to say well done. So that was
Well
really
done.
kind as well. So yeah,
well done.
But it isn't, you know, it mustn't be daunting. And I think the thing is, all I look at it is if you've got your house in order, then there's nothing to be worried about. And it's just not leaving everything to the last minute and keeping up to date with these things.
Yeah.
And your knowledge up to date, which is if you're a if you're GDC registrant, you know, you have to anyway.
Yeah, absolutely. And that's one of the hardest things, actually, Decky. And there's also another of my favorite compliance quotes is you don't know what you don't know. So, you know, making sure that whoever is keeping you up to date, and obviously we are privileged to be keeping you up to date, actually knows what they're talking about. So I think that's, you know, that's very important too, that you make sure you're getting the right advice, as Lisa has said as well.
Yeah, and I think you know, you're right, Decky, and even joining things like this is, you know, it's notable. You know, you need to mention all of these things. So we're so busy quite often looking at, right, what haven't we done, what don't we do so well, what do we need to improve, that you do surprise yourself when you start talking about actually all the really great things you do, which is obviously what hopefully, you know, it sounds like you did.
I think the £500 in his back pocket helped as well.
Always a sweetener.
I am joking, Pat, honestly.
No, they're incorruptible. I know you are. Yeah, so I mean, we had a CQC inspection a couple of years ago at our practice, and I'm not sure whether it was because they knew who I was. I don't think so, but they took everything apart. They really did. So, and in fact, my husband ended up asking the inspector if she used to work for MI5.
So interestingly, there was a practice I've heard about today who's had an inspection, and they were only there for 2 hours.
Yeah, I think I think CQC is changing as well. I do, and I chatted to them at the BDIA is a great meeting place for meeting up with people that are otherwise a bit difficult to get hold of. So I spoke to the head of dental regulation, Sam Banger, at that, and I also went to hear Rob Middlefeld speak, who is the National Dental Advisor to the CQC. And you know, I think things are changing there as well. I think that they've realized that dentistry is much lower risk than places like care homes and hospitals, and particularly maternity units, that sort of thing. And, you know, there isn't this desire to catch people out doing things wrong that there used to be, perhaps. So I think it's all the regulators are all going in a good direction as far as I can see it.
Yeah. No, I agree, because they did seem to be coming down very hard on some small things when there was like, are you kidding?
Yeah.
There's something much bigger that they should actually be more worried about.
Exactly.
Yeah.
As Pat and I have a mutual friend, we don't need to name any names, but she's no longer in dentistry, but she's still with CQC, and she has said it's having to evolve with the mistakes that they've made with the portal. I mean, that's just, you know, everything like that. They have to reevaluate everything, and they, you know, they are hoping, and they, you know, with getting to implement the right people now, that and it's not somebody new every 6 months, which is what we've been getting, that will improve. So yes, it's interesting to see that it's hopefully moving in the right direction. Because they need to evolve, or I think, you know, there's somebody else will be coming in, waiting in the wings to take their place.
Yeah, absolutely. But I think also that it really just needs to be that compliance is how we do things in this practice, rather than we're just doing it because the regulators might come and inspect.
Absolutely.
There's still a lot with that mindset. There is still a lot of people that have that mindset, I think.
Yeah, absolutely. But also there are there are still a number of people that you would not take your pet rat into their practice to have it looked at. You know, it is just dreadful what's going on. So CQC is needed, but it's needed to catch the people you can't take your pet rat to, rather than anybody who's on this call, that's for sure.
Yeah, no, absolutely. Right. Thank you so much. I always start and think, oh, what are we going to talk about for an hour?
Lisa, you know very well we're never going to run out of stuff to talk about. Not ever.
No, this is true. This is true. Oh, thank you so much, Pat. That's been really, really helpful. And thank you to everyone that's joined us or taking the time to listen. We've got one scheduled for next month, which I can't think off the top of my head. So hopefully we'll see everybody next month, and we'll do an update on everything that's happened between now and then.
Absolutely.
It's of interest.
Yeah, absolutely. So thank you, Lisa. Thank you, Sam, and thank you everyone for joining us. And whoever sees this when it's sent out.
And thanks, Decky, for your contribution. It's great to hear from you.
Absolutely, and Ellie too. So thank you very much indeed.
Thanks, guys. See you soon. Take care.
Thanks everyone. Thanks.